curious wishing to educate themselves on Islam. To support this initiative, you can contact us at the studio.
Assalamu alaikum wa rahmatullahi wa barakatuh. I am Dr. Nadia Bradford Swamad from Health Express Doctors Limited in Cunupia. Welcome to IBN's 20th anniversary Doctor in the House. So today we're going to talk about high blood pressure, or also known as hypertension. Okay, so if you hear the word hypertension, it's the same thing as what doctors would say as high blood pressure. So why are we talking about high blood pressure today? Because high blood pressure, if it is left untreated, could lead to some very serious life-threatening complications. So I want to share my experience when I worked in the hospital. Oftentimes we would see patients coming in with very, very serious complications. Could be in heart attack, they having a stroke, sometimes they might be having blindness, or even kidney failure. And when we take time to talk to the patient or the relatives, we understand that a lot of times they would have high blood pressure for many years and they would not be using their medications. So one time a patient actually asked me, "Doctor, why should I use a medication if I am not feeling sick and the medication doesn't cure me?" So before the end of this topic and this talk, inshallah, I will address that question. Think about it in the meantime. All right. So if you notice, many times when we go to the hospital or you visit a doctor's office, one of the first things they do is check your blood pressure levels. All right. That is where they put the cuff around the arm and it's squeezed for a period of time. And after a while it deflates, so it will inflate when it's squeezing and then deflates, you get some relief, you rub up the area, and then there will be a number on the machine. So today we are going to talk about taking our blood pressure, understanding what the readings say and what is the proper way of doing our blood pressure readings. First slide please. So high blood pressure, again, is commonly known as hypertension. It is a condition in which the force, is basically a measurement of the pressure or the force in the arteries when the blood is flowing. So normally, when there is a high blood pressure reading on the machine, there are 3 numbers. Okay, so the first number is called the systolic reading. And this usually refers to when the heart contracts, right? And it squeezes the blood out of the heart and it's flowing in the arteries. That is the top number. When the heart relaxes, that is the second number. And the third number, you usually see 3 numbers. The third number refers to the pulse, or how quickly the heart is beating in a minute. So again, let's just talk about that. We have 3 numbers, top number, then another number in the middle, and then one more number. But usually when the doctors or the nurses write, they'll write 2 numbers, right? So they usually refer to the first 2 numbers. Okay, next slide, please. Right, so we're talking about these 3 numbers. So if you have a blood pressure machine, remember you have a top number, a middle number, and one in the bottom, right, the lower part. Again, the top number is the pressure in the arteries when the heart contracts and it squeezes the blood out. The second number is so the first number is called systolic number. The second number is called the diastolic number, or basically, even if you don't remember the terms, just understand when the heart relaxes, what is the pressure in the arteries. And the third number is how many beats per minute the heart is beating at. So another reason that the nurses or the doctors will take their blood pressure initially when they enter the office is also to check for life-threatening complications. So someone who is having a life-threatening situation or illness, their blood pressure could be extremely high or extremely low. Another reason is to identify which one of the patients, what level of care this patient would need. Is it that this patient needs urgent, immediate attention, or if they could wait a little bit, because you might have a patient coming in who having a heart attack or a stroke versus a patient who is not that serious. So it helps the doctors and the nurses to prioritize, and we also call it triage. So which level of care this patient needs, how urgent it is. Another reason is to identify what is the baseline measurement for the patient as well. So you may go in for something that may not directly affect your blood pressure readings, but it will help the nurses and the doctors identify what is your usual blood pressure readings, and if it turns out to be a high number, they could now alert you, look, your blood pressure is elevated or you have high blood pressure, and this could be addressed as well. So why are we referring to this is because high blood pressure is considered a silent killer. You don't feel any symptoms while you have it unless something very bad or it reaches a really advanced stage. Okay, so if we can identify and diagnose someone before we reach the levels of complications, then we could actually prevent it, because once they are identified, we can start treating this patient, and this patient could control the high blood pressure to prevent the complications. Next slide, please. So, what are some causes of high blood pressure? So there are some causes that are modifiable, meaning that you can change, and there are some that you cannot change, okay? So some of the things that are non-modifiable, or some things that you cannot change, is like your family history. So people who family members have the parents and so on have high blood pressure, they likely to have high blood pressure. So it's something to do with genetics as well, and even like older patients tend to be at an increased risk of having high blood pressure. Some modifiable risks, things that we can do to help prevent it or control it, is decrease our salt intake, and obesity actually increases the risk of having high blood pressure. So even losing some weight, even if someone doesn't reach the full weight loss that they ideally should have, some weight does help to control the high blood pressure. Managing our stress levels. So for instance, a patient who in a position, let's say a managerial position, even a mother who stays at home and take care of the home and the family and the children, you know, each individual could have high stress levels, and we have to figure out ways how to manage it. So even if we have to employ or use relaxation techniques, breathing techniques, whatever it is, you know, taking some time out for yourself, even if it's just a 5-10 minutes in your busy schedule, to ground yourself, find back yourself. All of these things help manage stress. Decreasing alcohol, well, you know, as Muslims, we shouldn't even be drinking any, but for those who are not Muslims and they do drink, controlling the amount so that it is not alcohol abuse. Smoking. So if somebody were to stop smoking, this could actually have a significant improvement in their control of their high blood pressure. So as you get older as well, hormonal changes in the body could cause somebody to have high blood pressure. If someone have kidney disease, could cause you to have high blood pressure. Even a poor sleep pattern. So, you know, a lot of times with our devices and so on, we tend to wake out late a lot of times and have a reduced number of hours of sleep. This could contribute to patients having high blood pressure as well. Living a sedentary lifestyle, And even having uncontrolled diabetes or other secondary medical conditions could increase our risk of having high blood pressure. So, so high blood pressure is very important for us to identify and also manage and treat. So if we were to have any of these risk factors, it is important for us to try to change it or improve it to prevent us from having high blood pressure. So one of the important things we can do to help prevent the high blood pressure, first of all, is even identifying the numbers. What is our numbers? What is your last blood pressure reading? Do you have a blood pressure machine at home? How do you check for high blood pressure? What is the proper way to check to see what is the reading of our blood pressure levels? Right? So knowing our numbers are very, very important. Okay, if someone hardly goes to the doctor, which is really good, it means that it's likely, let's say someone have very good health and they don't have any reason to go to the doctor, they may not go to the doctor. All right, but again, high blood pressure is considered a silent killer. So you also want any opportunity you get, let's say you're visiting a relative, or let's say there's a health fair in your community, or you just want to find out what is your blood pressure readings. That is very important to know so that you can identify from early on exactly what is your blood pressure, what is your risk. And if you do have, let's say for instance, someone have an elevated blood pressure, in the second part of the show we will go into a little bit more details of what is your number and where you identify or where your number represent. Okay, so coming back now to once you identify, let's say for instance someone has an elevated blood pressure level, they can now institute changes to help control and go back into normal range to prevent them from actually reaching a stage where they need medications. All right, so some of the things a patient could do to help decrease or help control the high blood pressure is, number one, decrease our intake of salt. Very, very important. We have a lot of foods, a lot of things that we consume that have very high levels of salt in it. Okay, just try to think of some examples. What are some foods that you find the salt is actually higher or is a lot of salt in the food? All right, so let's just name a couple things. Number one, a lot of fast foods. So when we go on the outside and we buy a lot of fast food, sometimes the salt content is really high. Right? A lot of the snacks sometimes we have a high salt content in it. Even foods that we would make quickly, whether it is just the oven, use the oven or boil it, pre-prepared meals. Even tin foods have a high salt content in it because the high salt content also helps to preserve the food as well. All right, so we have to be conscious of the things that we eat. So usually I would advise my patients to try to prepare your meals at home as much as possible. Patients who have high blood pressure, I like to advise them, try to prepare your meals at home as much as you can, because let's say we be out there and you're working, you really need something to eat and you don't have food with you, then you likely have to buy. You can't go and tell the doubles vendor, well, this is too much salt. You're just basically trying to survive, so whatever you get, you eat to be able to move on. And sometimes, with all the different things that we add on to the meal, you don't even recognize it could actually decrease the intensity of the taste of the salt. So even like when we buy other things and we use ketchup and sauces and so on it, even if it's very salty, you might not even notice it because the salt content from the other condiments could hide or the taste of the others. Another advice I often try to encourage my patients to do is cook with less salt. So cook with less salt or no salt if you could, or even you start lessening the amount until eventually you could just be a minimum. And at the table when you're going to eat, you could actually have some salt and you could actually sprinkle it on top of the food so that you're tasting some of the salt, you feel that satisfaction, but the salt is not infused in all of the food. Right? So you still get the satisfaction of the taste of the salt, but it's not infused in all of the food. Okay, next slide please. All right. About the correct way to measure our blood pressure at home. So, first of all, you want to take 5 minutes and sit quietly. Okay, you don't want, as soon as you sit down, you put on the blood pressure cuff and you start measuring the blood pressure reading. So sit quietly for about 5 minutes. Make sure that the feet or the legs are not crossed. So you want your feet flat on the floor for 30 minutes before measuring the blood pressure. You want to don't have any exercise or caffeine and so on, because it could increase the blood pressure possibly. Make sure you have the correct size of the cuff, because if it is, and when you're putting on the cuff, you actually have a measurement, or if you look at it, there's a line, a demarcation that will give you an idea. If you go past this line or you're not reaching this line, that the cuff is probably not the proper size and you could actually have a wrong reading. So if the cuff is too large or too small, you could actually have an incorrect reading. All right? Ensure that the arm is supported at the level of the heart. So you want to make sure that the arm is not too high or too low, because that as well could interfere with the readings of the blood pressure. All right? You want to take 2 readings. All right? So let's say you do the first reading, you write it down. Then you could wait a little bit, a couple minutes after, at least 1 minute apart, and then do the other reading. And we could take the average of those readings. So this is one of the ways that you can actually use to have a correct blood pressure reading. When it is you do your blood pressure, you want to write it down and document it. So even if you use your phone and you record it on your phone, so that the next time you visit your doctor, you can take these readings with you, so the doctor would be able to know, is the medication working? Should your medication be adjusted? And if not, then what else could be done? All right? Because as you start to have improved lifestyle and use your medication, there's a possibility the numbers will become more controlled over a period of time. And again, the doctor will want to consider adjusting the medication, or if you're using the medications for a period of time and there is no control of the blood pressure, then the doctor will also want to consider adjusting the medication. So at this point in time, if you do have a blood pressure machine, you want to check it to see if it is working. You want to consider if it needs batteries, because sometimes the cuff or it may not be inflating, or it may be reading error. You know, this is a very, very good instrument or equipment to have at home to check for your health. So a lot of times patients, when they feel unwell and they have a blood pressure machine, they will check their blood pressure and they will call me and say, Doc, you know, my blood pressure is X, Y, and Z and I'm not feeling well. And I actually like that, because it gives me an idea if the blood pressure is too high, if the blood pressure is too low. Instantly, I already have an idea, is this patient possibly dehydrated? You know, what is happening with this patient, you know? So it's a good idea to have a blood pressure machine at home. So even if you could check yourself intermittently, or you have an elderly relative, parents, or even someone may be visiting at your home and they feel unwell, you can consider doing the blood pressure for them. Sometimes, again, they may not even know that they have high blood pressure, because, again, it is a silent, we call it a silent killer, because you don't feel any symptoms. And look at the words, look at the term, silent killer. So it means it is so serious that it could directly lead to the death of someone. All right? And how does it do this? Because when the pressure is flowing through our arteries at a hard force, or the blood is flowing through the arteries at a very hard force, over a period of time, like a number of years, you could actually damage the arteries. And there could be like a tear in the arteries, and the blood, instead of flowing along as it's supposed to flow, would bleed out. So when we talk about the heart, you would have heard of the term heart attack. One of the descriptions of a heart attack is because somebody have high blood pressure and there's rupture and the blood is not flowing as it's supposed to flow, okay, and the heart muscles die. Similarly, when we talk about stroke, someone having a stroke, all right, it could also mean that the pressure in the arteries are too hard or too high, and over a number of years it damaged these arteries, and the blood where it's supposed to be flowing to bring oxygen and nutrients to all parts of the brain is now flowing outward. And that part of the brain that was supposed to be receiving the blood flow, over a period of time started dying. It could just be in a matter of minutes to hours. All right, and that is how somebody could end up with a stroke and could possibly from a stroke could die. Similarly, from having a heart attack, the patient could die. Now, let's talk about the eyes, all right? The eyes and the kidneys. The arteries to the eyes and the kidneys are very fine, very tiny. So when we have this high force or high pressure of blood flowing through these very tiny arteries, it causes damage to the arteries. And what happened? When we have damage in our tissues and so on, the body tends to want to heal it back. So it's like if you get a cut in your hand and, after a while you notice it stopped bleeding because it formed a clot. So in the arteries, they get damaged, and then platelets and so on come and aggregate or come together to form a clot to heal that area. And then let's say get damaged again and another clot will form. And over a period of time, you will have what we call scar tissue forming. All right? And it actually, because the artery is so fine and tiny, it starts to block up. It starts to occlude or block the blood flow. All right, so then patients start feeling symptoms of blindness, and it could actually get very, very bad, and they could actually go completely blind. All right, and when we talk about the kidneys, is it a similar description? Because of the very fine arteries and repeated damage over a period of time, the kidneys could actually go into failure where it doesn't function. The function of the kidney is basically to excrete toxins from the body, all right? But if the kidney itself is not receiving the blood flow to be able to function and do its job as it's supposed to, then the kidneys could fail. And this is how patients end up going into kidney failure and needing dialysis just to live. So all of these descriptions are very frightening. And unfortunately, these are things that patients go through every single day. It's very, very serious complications. And if we could simply identify, first of all, know our numbers, identify where exactly our numbers lie. Are we controlled? Are we elevated? Are we type 1 high blood pressure or hypertension? Are we type 2 high blood pressure or hypertension? Are we supposed to be using medications? All right, because you can see a healthcare provider, you could go to the health clinic, you could go to your doctor, all right, and say, "Doc, look, I measured my blood pressure and this is the reading that I got." Okay, and then the doctor now could advise you and start you on treatment if you need to be started, and follow up with you as well. So if we could prevent a patient from having a stroke or a heart attack or kidney failure by intervening, let's say 5 years before, all right, and identifying high blood pressure, treating it, and the patient actually be compliant with the medication, institute the lifestyle changes that are needed, all right, then we can actually prevent these major complications. Again, we understand, yes, all of us at some point in time, nobody lives forever. We understand that, yes, but we want to live good, quality of life. Okay, no one ideally wants to be very ill for many years. As much as we could prevent it, because you want to enjoy your life, you want to enjoy your children, you want to enjoy whatever you have in life. Thank God for it. Okay, and nobody wants to be visiting hospital 3 times for the week, you know, getting repeated heart attacks or having you know, serious complications over and over. You know, this is really, really tough on patients. You know, we really feel, I mean, I'm so sorry for who it would have happened to, and if you know anybody who go through these difficulties, you'll realize how difficult it is for the patient, you know. So this is why we have these types of talks, so that we can help the public understand how serious a condition high blood pressure is, and to give advice in what they can do to prevent it or treat it once they recognize where their numbers lie. All right? So I hope everybody understand. I hope if you have a blood pressure machine at home, you go and get yourself tested, identify what is your numbers, and in the next part of this show, after the break, we will go in a little bit more details of where your numbers are. So if you have a blood pressure machine and you don't remember your last blood pressure reading, you could consider to go and quickly get your readings. So when we start to talk in the next part, you'll identify where exactly you stand. All right? And again, Jazakallah, thank you very much for allowing me to talk to you on this topic. See you in the next part. Assalamu alaikum.
Never too early, never too late to recharge and hydrate. Get your daily dose the right way. Grab our oasis, now why wait? Never too early, never too late to recharge and hydrate. Get your daily dose the right way. Grab our oasis, now why wait? The greatest, the safest, oasis for sure. Oasis, it's purer than pure.
Fruitopia, the drink that rocks your lunchtime. Fruitopia, Fruitopia, it's a drink that's high. The citrus punch, fruit punch tastes nice. Guava, pineapple, that give me a vibe. We don't want nothing less compared to the rest. Fruitopia the best. Punch any thirst when it comes to the test. Perfect thing for my lunch. Flavors pack a punch. Fruitopia, Fruitopia, it's a drink that's high. The citrus punch, fruit punch tastes nice. Fruitopia, the drink that rocks your lunchtime.
Try our new passion fruit flavor today. Taste the passion.
Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to IBN's 20th anniversary Doctor in the House. I am Dr. Nadia Bradford Swamad from Health Express Doctors Limited in Canopier. So we are talking about hypertension today, and in the second part of the show we are going to address or identify numbers in our blood pressure machine and understand where exactly we lie, or what does our blood pressure number mean. Next slide, please. So let's just mention that at any point in time, these are some times when you need to contact your doctor immediately or go straight to the emergency department. So if you check your blood pressure reading and you got a reading of 180 or more than the top number, the first number, is more than or equal to 180, over, the second number being 120, then that is something that you need to get medical attention for. Or if you have a severe headache, okay, sometimes it's like the worst headache you ever experienced in your life, or a severe headache that is not going even though you use any type of pain medication. This is another emergency that you need to seek urgent and emergency medical care for. If you're experiencing chest pain is very serious. So usually as a doctor, even if a patient has signs of symptoms and they describe the chest pain as burning and they think it's because of acid reflux or because of something that they ate recently, we still need to rule out and make sure it is not a life-threatening condition. So sometimes a patient could have acid reflux for many years, and then they could also have a heart attack secondary or on top or with the acid reflux. So the patient may feel, well, I have acid reflux, it's always acid reflux. It don't always have to be acid reflux, or it don't always have to be a muscle pain. So when you go to a doctor, the doctor usually would want to rule out a heart attack. Chest pain is very, very serious, so the doctor may use a ECG, also known as a EKG, to check the electrical rhythm of the heart to make sure that you're not having a heart attack. If you experience weakness, let's say especially on one side of the body, all right, you find that it's not functioning or it's feeling heavy, sometimes patients will describe it as a heaviness on one side of the body, or you're experiencing slurred speech, you find it difficult to formulate your words, your tongue feeling heavy, people telling you, asking you, how are you sounding? So you're sounding like, you're not talking clear as you usually would. Also, if you experience shortness of breath, difficulty breathing, all right, these are times that you want to seek urgent medical attention because these could be life-threatening conditions. If you experience confusion, all right, so let's say, for instance, you find that you're getting lost, you don't know where you are, you're not sure how you're feeling, you're just feeling unwell, you're just feeling, you might be having pain, but you're just feeling confused, you're not sure what time of the day it is. These types of things, could be signs of stroke as well, and it could be something that you need urgent medical care and attention for. Also, if you have visual changes, you started having double vision, blurry vision, you're having pain in the eyes, all right, these are things you want to get urgent medical care for as well. So this is not only for you as a patient, it could be for a relative. So if you have a parent or grandparent or aunt or someone, another relative in the home who are experiencing any of these symptoms as well, you also want to seek urgent and emergency care for them. It is okay if it is you go to the doctor and everything turned out to be okay. We're very, very happy about that. But it is not okay if it was an emergency and it was not treated and it was not addressed. Then there's a saying, time is muscle. So time is muscle, meaning that the quicker the patient gets medical care and attention, then we could save whatever remaining could possibly save. So let's say somebody having a heart attack and it's possible that it could be treated, right? We could actually prevent someone from getting worse. Even like a stroke as well, if it is treated in time, it could prevent the patient from having much worse complications as well. All right, so these are important. So it's okay that sometimes patients would say, complain, when everything turned out to be good, they'll be like, oh gosh, so I just waste my time. I come here and I wait so long and then it turned out to be nothing. Nope, you didn't waste your time. All right, we are happy if it turned out to be normal, and then we could say, okay, well, it's possibly muscle pain or it could be something else causing it, and that is okay too as well. But at least the life-threatening complications and conditions we need to address and identify and treat. So the next slide we're going to talk about is identifying exactly where you are in your numbers. So do not get intimidated by this slide. Remember, your blood pressure machine going to have 3 numbers. We're going to have a top number, a middle number, and the last number. So usually the last number tends to be the pulse, or how much heartbeats, how much beats you have within a minute. So when we talk about the blood pressure levels, we normally just talk about the first two numbers, okay? So these readings refer to your first two numbers. The last reading not addressed here at this point in time. We're just talking about the first and second numbers. All right, so try to remember what was your top number and what is your second number, right? So we're talking about systolic and diastolic. Okay, so your top number, is it less than 120? All right, and then is the second number less than 80? Then you're likely falling into normal range. However, if we have a patient whose top number is 90 or less, and the second number is 60 or less, then they would likely be considered as having low blood pressure, and that in itself is also an emergency. So normal is usually referred to as less than 120 in the top number, and the second number being less than 80. So we have 5 different stages mentioned here. We have normal. We're just orienting ourselves with this slide, right? Elevated, stage 1 hypertension. Remember, hypertension just means high blood pressure. Stage 2 hypertension, and severe or an emergency level. And these numbers and these values are according to the American Heart Association. All right? So, again, orienting ourselves, we have normal, elevated, stage 1 hypertension or high blood pressure, stage 2, and severe. So we want to identify your number or your last blood pressure reading, where exactly you fall. So we already spoke about normal. Let's talk about elevated. All right. Did your top number, is it between 120 to 129? Is the second number, even if the second number is less than 80, once the top number is between 120 to 129, then you would be considered as having elevated blood pressure levels. Okay, so let me repeat that again. So remember, we're talking about the first two numbers, top and then the second number. All right, so if your top number fall within 120 to 129, despite the second number being less than 80, once that top number falling within this range, then you would be considered as having elevated blood pressure levels. So going on now, the next stage we're talking about is what is referred to as stage 1 hypertension or stage 1 high blood pressure levels. Again, we're referring to the first two numbers on your blood pressure machine. If your top number fall within 130 to 139, or the second number below falls within 80 to 89, any of these, then you would be considered as having stage 1 high blood pressure. Let's just go back over that again. So if your top number falls within 130 to 139, or the second number is 80 to 89, anywhere within that, then you would be considered as having stage 1 high blood pressure. So let's look at the other stage, stage 2 hypertension or stage 2 high blood pressure. If your top number is more than 140, more than equal to 140, and the second number is, this number is supposed to actually be 90. It's just a bit of an error, right? And the number after is more than or equal to 90, then you would be considered as having stage 2 high blood pressure or hypertension. So again, let's just review that. Let's say your blood pressure reading top and the first number and the second number. Okay, if your first number is more than or equal to 140, And the second number, that number is supposed to be 90, 90, okay? So that 1 in front is an error. And the second number is more than or equal to 90, then you would now be considered as having stage 2 high blood pressure or hypertension. If someone, going on to the next stage, has a blood pressure reading of more than or equal to the top number being 180, or the second number being more than or equal to 120, then this would be considered an emergency. This is something that you need to seek urgent medical or emergency medical care and attention for. All right. So when we identify where we are with our numbers, we would need to understand, well, what is the next level? What is the next step should I take? So if you are not in the normal category, all right, then you want to consider seeking advice or seeking counsel from your doctor. You could go to the health center, your private doctor, okay, and let them know, well, this is my readings, and you could take a number of readings. You don't just have to take one day, all right, and take it to your doctor. This is called a blood pressure logbook, all right. You take this blood pressure logbook to your doctor, and they will go through the numbers, and they will as well identify where you are and will be able to advise basically on what type of treatment or what type of management is necessary for you. So normal is good, and again, we can identify that if we have any high risk factors in our life, we try to modify it or decrease it as much as we could. All right, but if somebody is in elevated stage, then the doctor more than likely will advise you to do lifestyle changes so that you go from elevated back into normal range. If someone is stage 1 hypertension, depending on, based on the guidelines, if it is to also have other comorbidities or other conditions, or over a period of time they attempted to do lifestyle changes and it did not help, then more than likely the doctor will consider starting medications. If someone is stage 2, then most likely doctor will start medication. So usually we don't just take one reading to diagnose somebody as having high blood pressure. So this is why it's very important to do a blood pressure log or take records of your own blood pressure, so that when you go into the doctor, he can make an informed decision and it won't just be one reading. Again, if a patient have very, very high blood pressure that bring them into the emergency category or level, then this will more than likely possibly mean that they will have to get treatments, and it could even be treatments into the veins, okay, to help bring them down into safer ranges or safer blood pressure levels. Okay, so depending on which stage you are at, the treatment or the management could differ. All right, and it's always important for us to identify and know our numbers. So let's just say if someone is elevated, you don't want to just know, well, I'm elevated, and we don't continue to check or monitor to make sure that you go back into normal range. All right, so you want to always have an idea, what are your numbers and what is the next step for you, and be compliant with that. So if the doctor gave you treatment to use, the doctor advised you to change your diet, to decrease your salt intake. You know, there's also something called the DASH diet that is advised. You could go and look it up, DASH, DASH diet. And you can go and you can look it up. That's something we could talk about on another show, inshallah, God willing. All right, but this is advised also for patients with high blood pressure. Okay, and you want to make sure that you implement the changes that is necessary to help reverse and reduce your blood pressure levels. Next slide, please. Okay, so this is something that we would have talked about before. Some of the complications of having a high blood pressure, again, is like heart attack, heart failure, concerning the brain, you could have stroke. Over a period of time with the arteries in your brain getting damaged repeatedly, You could also have like memory, problems with memory, cognition, problems with just functioning, all right? Also, when it comes to the kidneys, you could have kidney failure. And kidney failure, you could end up needing dialysis to even live, because sometimes, you know, patients would say they don't need the dialysis or they don't want to use the dialysis, and then in a very quick period of time, they could deteriorate rapidly, you know. So it's something, it's a really important decision that the patient need to make. But if we could prevent ourselves from even reaching to have to make these decisions, would be even better. And we can do that by controlling our blood pressure levels. So we have other things we're supposed to control as well to prevent it, right? Like your diabetes and your cholesterol as well. But today our topic is specifically targeting high blood pressure. Another thing too is, again, damage to the eyes. So it can, high blood pressure could lead to blindness, all right? And also damage to the blood vessels, again, especially in the brain, or even other parts of the body could lead to something called aneurysms, where the blood vessels swell. So let's say it have a particular size and shape because of repeated high blood pressure and damage to the levels, it actually bulge out. Okay, and an aneurysm could actually burst and bleed, and that is an emergency, and patients actually die from that as well. Okay, so we are understanding better now our topic of high blood pressure or hypertension. We are recognizing what our numbers mean, where we stand, that if we need to seek medical attention, and what are some of the things that we can do to help reverse it. Let's talk a bit about exercise. So ideally, it is advised that a patient exercise at least 30 minutes a day, 5 times a week. So sometimes it is, you know, patients get frustrated with this, and especially patients if we have some size or weight or obese, then they will be like, but doc, I've been doing this exercise for a long period of time and I find like I'm not losing weight. So the question is now, what if someone does the exercise 30 minutes a day, 5 days a week, and they find that they don't lose the weight? Should they stop? Should they? Because if, you know, they get frustrated and they say, but it's not making a difference, I'm not losing the weight, you know, should the patient stop? And the answer is absolutely not. Because while weight loss is actually a benefit of exercise, we also need, even if somebody was not obese or have extra weight, they as well need to do the 30 minutes a day, 5 days a week, to help with the circulation. And that will also help to control the high blood pressure as well. So whilst everybody who have extra weight might want to lose weight, and that is good, it actually is good for us health-wise. That is not your initial goal. The initial goal and aim is to actually do the 30 minutes exercise 5 days a week consistently. All right, so I like to tell my patients, try to do something that you could see yourself doing for the rest of your life. Because even if you meet the goal of the weight loss, and you know, it's still something that you need to help with the functioning of your body, even to prevent high cholesterol, even to prevent or treat high sugar levels, even to help the joints to stay healthier, and to help prevent things like osteoporosis and brittle bone and these types of things. So there's activities. So usually to help with the bones, you want to do some weightlifting as well, okay? But the point is, you want to maintain physical activity regardless of what is your size, because it will still help. Once you start doing this after a period, even in a short manner of a few days, your system will start having some improvements, and long term it will help control the blood pressure levels as well. So overall, it's good and very beneficial to maintain doing that 30 minutes exercise 5 days a week. So whether you want to do a walk-in, a stroll-in, you have a stationary bike at home, you want to do exercises at your home, all of these are fine. Your average time, make sure it's about 30 minutes, and you just be consistent with it. All right, so next slide, please. All right, so yes, we were talking about exercise, which is 150 minutes a week or 30 minutes a day for 5 days of the week. All right, weight loss is very, very good and beneficial. So there's a little slight error here. So even losing like 10% of your excess weight could make a difference in your health. Stress reduction, we did mention about it, to identify in your life what could be causing you to feel stress or to have stress, especially people who are managers or who manage other people or CEOs, or if you have your own business. I mean, people tend to think that someone owning their business might be easier than having a regular job, but it could actually be more stressful, because I always tell my patients, when your workers go home, sometimes the owner of the business still working into late hours into the night. All right, so their level of stress may be higher. And sleep hygiene, very, very, very important. Sometimes when we go to bed, we take up our phone because we want to relax and unwind, okay? And that is very understandable. However, sometimes the light from the phone could stimulate our brain and have it in a sort of hyperactive stage, so it's harder for the brain to sort of calm down and be ready to sleep, okay? And what might help that is when you want to sleep, instead of, I mean, going on your phone is okay, but when it's immediately before bedtime, you want to consider maybe having a book instead, because you know you're still having something to read and relax, but without that large amount of light entering and stimulating your brain. All right, and you want to avoid energy drinks as well, because these two could help keep your blood pressure high. Also, again, we talk about the salt. So you want to identify the foods that have a lot of salt in it, decrease your consumption of these foods, and if you drink alcohol in excess, to reduce the alcohol consumption. Okay, so some other points we want to talk about is high blood pressure or hypertension medications are usually for lifetime. So sometimes, yes, we may have patients who did significant changes in their life and you go into normal range. You're taking medications and you go into normal range. And sometimes patients may feel inclined, well, I reach normal range, so I want to stop the medication. And in short order, they might stop, and then in about a month or couple weeks, again, you notice the blood pressure coming up, going back up. It's likely that they're in normal range because the blood pressure medications keeping them in normal ranges as well. So do not think, well, because I reach normal range, I could just stop my medication, stop checking my blood pressure, and go back to the life that you had. Then it's very likely we could get back into the stage of, having high blood pressure as well. So usually when somebody reaches a level of having high blood pressure, sometimes they tend to be on medications for life. The doctor may adjust the medications, bring it down to the weakest strength if you're within normal range, to help maintain you and keep you at normal range. All right? So you don't want to just stop your medications for yourself. You don't want to stop checking your blood pressure. You want to always have an idea of what is your blood pressure readings, so that you would know where you stand or where you are at any point in time. All right? Also, just understand that when you use the medication, you don't get addicted to it. You are not dependent on it, you know. So it's not, patients often fear using medications because they think that they will become addicted to the medications. They think they will become dependent on it. So it's not an addiction or dependence like if you have someone who having an addiction to drugs or alcohol or certain types of substances. All right, it's actually that your body needs the medications to keep the blood pressure at a normal range to prevent it from causing damage to the arteries. All right, so you don't need to fear that when you go on these medications, you will get addicted to it. So high blood pressure medications usually do not cause patients to be addicted. And actually, when it is you use the medications and you control the blood pressure, it's actually a protection for your heart, your brain, your liver, your kidneys, your eyes, basically a protection for all of your organs by controlling your blood pressure levels. Because remember, the arteries It's throughout your entire body. All these cells and all aspects of our body receives a blood supply, because the blood brings oxygen and it also brings nutrients to all the tissues and all the cells. All right. So when these arteries get damaged by high blood pressure, then all over the body could get damaged as well. All right. Next slide, please. So I just wanted to talk about this. So according to PAHO, or the Pan American Health Organization statistics in 2022, look at the statistics for Trinidad and Tobago, okay? That 30% of men, that is like 3 out of every 10 men, and 23% of women, okay? So let's say in 100 women, that is about 23, have high blood pressure, hypertension. So can you understand how serious? Just look at it a bit and understand. 30% of all the adult men in Trinidad and Tobago have high blood pressure. What does that tell us? It tells us, well, first of all, men have a higher percentage of men have high blood pressure. It tells us that women, a high percentage of women have high blood pressure in our country. All right, but when they compare it to other areas in the region, we actually have almost 40% or more. Our level of high blood pressure is much higher than other countries in the region. All right, so this is very, very important statistics for us to understand how serious this matter is, how serious this situation is for us in Trinidad and Tobago. So it is necessary and important for us to identify, am I one of the 23% of the women? And for men, are you one of the 30% of the men? And how you would know that? You will know that by checking your numbers, measuring and checking your blood pressure levels often. All right. And also remember, you have to identify what are the risk factors, and if you have any of the risk factors, to try to mitigate it or try to decrease the risk factors so that you don't end up actually having high blood pressure. Again, let's talk about if we recognize, I wanted this whole segment just to talk about our numbers, all right? So once you recognize what is your number, is it normal? Is it elevated? Is it stage 1 hypertension? Is it stage 2 hypertension? Or is it at the emergency levels? Then you need to identify where you are, and if you're elevated, stage 1, stage 2, you need to urgently, seek advice from your doctor. So if you need treatment and so on, they can start it. Usually treatment is started definitely at stage 2. Stage 1 would be dependent on if you try lifestyle changes and it didn't work, or if you have other medical complications as well. And definitely if you're in emergency range, you need to seek medical attention as an emergency. All right, so just to mention as a disclaimer that remember, this is just general information, and you have to get your individual attention from your doctor as well, so that you can seek medical attention, basically what is specific for you. Next slide, please. All right, and if it is you all have any questions, you want to understand better, you're not sure what your numbers are, it's a bit confusing for you, feel free to contact us. We will be very, very happy to explain it to you, go through it with you, and advise you on your next step. Okay, and again, Jazakallah, thank you very much for allowing me this opportunity to talk to you about high blood pressure. And may Allah keep us all healthy. May God bless you and keep us well. I am Dr. Nadia Brafit-Swamad from Health Express Doctors Limited. Remember to seek your individual care, and see you in the next one. Assalamu alaikum wa rahmatullahi wa barakatuh.